Hi, I'm Rebecca Lundy. We will be reviewing the informal assessment results for Heather Smith, a student with a medical diagnosis of Pitt-Hopkins syndrome attending ESY services. This informal assessment was conducted on June 15, 2018, during her ESY school day. All assessments conducted through the school psychologist, occupational therapist, physical therapist, speech therapist, and classroom teacher have several common needs listed for Heather. The one that is most commonly reoccurring and essential to growth throughout her education and adulthood is the need for a functional communication system. According to her cognitive evaluation, Heather is categorized as delayed with a percentile of 0.1%, meaning her cognitive functioning is similar to that of a toddler. This makes traditional academic instruction inappropriate at this time. Learning happens through communication, making this essential to increasing Heather's learning opportunities. Heather's parents have requested that she use an augmentative alternative communication device that is presented on an iPad and carried by a strap for her communication needs. In alignment with data collected during formal assessments and the parental request, it is recommended that communication is the focus of Heather's academics. With this in mind, reoccurring and frequent informal assessments are necessary to monitor her progress. The informal assessment is designed to look at current levels of communication in 3 separate areas. It is a criterion-based assessment designed to provide a raw score that is converted into a percentage, with mastery being 100%. This assessment focuses on the understanding of communication and does not rely on Heather's knowledge or expertise of her AAC device. Expressive communication can be monitored through body language, verbalization of sounds, or the use of her AAC device, with the first 5 activities monitoring her abilities and observing her communicative behaviors. The next 5 items are rated on a scale of 1 to 5 in her ability to expressively communicate. The last section is on receptive language skills. These are rated on a scale of 1 to 10, with 10 being considered mastery in each area. These items are then totaled and a percentage for each category is given. According to the informal assessment, Heather utilizes inappropriate forms of spontaneous communication that a person who is unfamiliar with her would have a hard time interpreting the meaning. She will clap her hands when excited or when requesting a preferred object. To gain another person's attention, she will touch them, hit, or grab at their clothing. To express displeasure, she will whine, hit, cry, or push and drop items. Heather does accept hand-over-hand prompts and modeling for use of her AAC device, but it is still uncertain if she understands its use. In the area of expressive communication, Heather achieved a raw score of 10 with a percentage of 40. This indicates that she has some nonverbal communicative abilities and is wanting to express wants and needs, but does not use her voice spontaneously. In receptive communication, Heather had a raw score of 17 with a percentage of 34. This is able to follow some verbal, one-step directions, but needs a high level of prompting. This score indicates that communication she receives receptively needs to be short and literal. Instead of saying, "Heather, please sit down so we can eat our breakfast," the person will need to adjust their communication command to "sit" with gestural support. Too much talking makes processing of the request difficult, leading to her being unsuccessful. It is recommended that she be encouraged to use her device consistently throughout the day and have it available at all times. The informal assessment yielded important information that I was looking for in how Heather communicates. Her strengths are in her willingness to comply with the assessment and follow one-step commands with verbal and gestural support. Her greatest weakness lies in expressive communication towards others. These results are demonstrative of those taken during her 3-year evaluations, specifically those assessments conducted by the speech pathologist that are related to expressive communication. Should the opportunity arise to use this informal assessment again, I would first have a trained speech pathologist review it. Since this course is being conducted over the summer months, I was unable to have a speech therapist review the assessment. I feel that it did provide a basis of understanding Heather's strengths and weaknesses, but question its accuracy without having a speech therapist review the assessment and the results. I would have the therapist examine the informal assessment to ensure that it does measure the targeted areas and provides a realistic sample of her communicative strengths and needs. Due to the focus of the assessment, I feel that it would be better to provide a full picture of Heather's abilities if conducted several times in different settings. Finally, I would also have the speech therapist present during part of the assessment. This would help ensure that the results are accurate. Thank you for your time.